Joining us on Polycom are Dr. Al Johnson of Johnson Medical Associates and Dr. Frank Lawless, the chairman of the Dr. Phil Show Advisory Board and co-founder of Lawless PV Center. Dr. Johnson, let me start with you because I want to talk a little bit about the brain. I've discussed the traumatic brain injury and how it can affect what's going on here. Talk about that some, if you will.
When you have a traumatic brain injury, it affects the cells. It affects how a person behaves. It affects the brain hormones, and they become non-functional with lack of motivation, lack of focus, lack of energy. What I use is hyperbaric oxygen treatment to help revitalize those cells.
And so with a traumatic brain injury, which can happen, there's a lot of different ways to measure that. The Glasgow scale is one that we can use to determine your level of pre-trauma amnesia, your level of lack of consciousness, to determine, along with doing some imaging on your brain to figure out the level of severity here. But the point is, when some of these areas are impacted, then that's going to express itself in your problem solving, your problem recognition, your motivation, your emotion. And with this hyperbaric treatment, which reoxygenates these parts of the brain, it's very resilient. It can come back, and all of a sudden you go, wow. Not all of a sudden, it takes time across, but we're talking about weeks, not years here, across time. And the success rate here is very high, Dr. Johnson, true?
True.
And so this is not like a long shot fringe sort of thing. Mm-hmm. It can help. Dr. Lawless, you've been listening to this whole thing, and you and I have discussed this previously. There are things that Kate can do, exercises that she can do with regard to her functioning, with regard to getting her brain awake. Talk about this a little bit.
Well, first of all, I want to mention that there is often an autoimmune response that occurs years later. So what may be happening now is basically a level of inflammation. And as Dr. Johnson pointed out, that this hyperbaric chambers can help resolve. And like you asked me, there are certain exercises that can stimulate the regrowth of nerve cells, the reconnection of nerve cells. And we can combine those things with hyperbaric chambers so that they basically can revive her brain back to function.
Yeah, so point is, there's some real hope and help here for changing some of these things in non-invasive ways. So I said at the beginning, I don't do voyeuristic television. You know, there's a line in the open to this show that says, today is going to be a changing day in your life. That was just something I said on camera that was picked up 15 years ago, but it was something I said from the heart and that I meant. And when people come here, when people watch this show, I do mean for it to be a changing day in their lives. And I do mean for this to be a changing day in your life, and therefore in your lives.